The 1918 influenza pandemic infected nearly a third of the global population and killed more than 50 million people over the span of 2 years. The world was ill-prepared 100 years ago to combat a pandemic. No flu vaccine or effective medicines existed. The pandemic spurred many countries to create or revamp their health ministries. Governments around the world came to recognize the need to coordinate public health efforts at the international level. Fast forward 100 years, and we now thankfully have more tools to prevent, detect, and respond to emerging health threats. We are blessed with medical countermeasures such as vaccines, diagnostics, and antiviral drugs. We have fine national public health institutes with capacities such as outbreak surveillance and response. We have created international frameworks such as the Pandemic Influenza Preparedness Framework. Nevertheless, we remain very vulnerable. Many of the same threats from 1918 remain relevant today, and the challenges of manufacturing and distributing countermeasures at scale are significant. In the United States, influenza is our top priority infectious disease threat because it's the one we consider the highest risk of causing a pandemic. Pandemic influenza preparedness is a global responsibility, one that requires sustained prioritization from nations around the globe. There is going to be another influenza pandemic sooner or later. We need to strengthen the global action plan for influenza vaccines to build national and regional capacity to rapidly manufacture and distribute life-saving vaccines and other medical countermeasures. It is only with these tools that we will be able to turn the tide against a rising pandemic. Over the next 90 minutes, let's make a frank examination of the lessons from 1918. Let's be honest about where we are and where we need to go. Through close collaboration among nations and across sectors, we can successfully enhance the preparedness of all of our countries for the next influenza pandemic.
And I think it's extremely timely that we're having this event to remember that as fearsome as the Ebola viral disease is, the one pandemic that has cost millions and millions of lives in 1918, more than World War I and World War II combined, has been the pandemic of influenza. And the threat of the next pandemic is real. As Secretary Azar said, it's not if, but when.
It really was the worst catastrophe of the 20th century, if not of any century, and it was truly global. It erupted at the tail end of the First World War. It engulfed the globe in 3 waves, and by the time it receded in 1920, it had infected 1 in 3 people on Earth, 500 million people, and killed between 50 and 100 million of them. People at the time perceived it as terrifyingly random in the way it struck humanity. And it was only later when statisticians started poring over the data that they began to discern some patterns. And then it became clear, as one French historian, Patrick Zilberman, put it, that although the flu may have been democratic, the society it struck was not. In Rio, it was the mushrooming shanty towns that bore the brunt of it. In the Norwegian capital, the death rate rose as apartment sizes shrank, while in Paris, statisticians were foxed by their observation that the highest death rates were recorded in the wealthiest neighborhoods until they realized who was dying there. It wasn't the owners on the Étage Noble, it was the maids in the cramped and chilly Chambre de Bonne at the top of the buildings. In fact, 1 in 4 women who died in Paris in the Spanish flu was a maid. In a UK study of the 2009 so-called swine flu, in the UK, the death rate was found to be 3 times higher in the poorest quintile of the population than in the richest quintile. And in a future flu pandemic, there is no doubt that the developing world would bear the brunt. So I think the message from 1918 has to be that while disease surveillance and improving vaccines is critical to pandemic preparedness, we also have to continue to address long-term issues of inequality in healthcare.
In terms of what we need going forward, we do need universal flu vaccines. They are a long way off. We need more effective vaccines. We need better therapeutics, more effective therapeutics that we can use to treat acutely ill patients. We need better diagnostics. We have the benefit today of digital technology, telemedicine, big data, surveillance, improved global coordination. That is in the plus column. In the minus column, we have a world that is globally interconnected. Pandemics will spread around the world within weeks, and we do not have the technologies that we need to develop the therapeutics and vaccines that we need rapidly enough at this point in time.
In WHO, what we're trying to do is emergency or health security is a daily business. It's actually 24/7, and it's a mindset issue. And we have already introduced like a National Security Council concepts into our system. We started with daily briefings on the global situation of any outbreak. And we're now relying, of course, on a dashboard, and which is near real time.
Another pandemic is certain, but the timing is unknown. Efforts for preparedness must truly be global, with each country and each partner contributing to the overall efforts.
And global coordination is absolutely key. This cannot happen one country at a time, one community at a time. It can only happen if we see this as a need for a global system of coordination and in the context of global health security. Because the disease is unpredictable and the current capacities are spread very unevenly.